Hello, my name is Dr. Dowtin. I graduated from Bowie State University, or BSU, School Psychology Program in 2013. Also from Gallaudet's Clinical Psychology PhD program in May 2018. Now I'm currently a nationally certified school psychologist, or NCSP, and I've been that since 2013. I'm also certified in Parent-Child Interaction Therapy, PCIT, since 2016. Also, I'm a licensed clinical professional counselor, LCPC, since May 2018. Around that time, I became an RPT, or registered play therapist. The reason I became a registered play therapist at that time is you have to be licensed in order to become an RPT. During my time at Gallaudet, my research was about understanding the training and supervision experiences of people who were learning to use play therapy with deaf and hard of hearing clients. My research was qualitative, a phenomenological study that applied grounded theory. From that research, I worked with Dr. Lori Day to collect and gather the information and produce a peer-reviewed journal article. You can read more about my research in the International Journal of Play Therapy, or IJPT. The IJTP is actually an APA-approved journal. APA meaning the American Psychological Association. Yep. My journey in play therapy started way before I started at Gallaudet University. I was searching for play therapy training certificate programs when I was in my last year of undergrad. I found a certificate program at Johns Hopkins University, but that program was a postgraduate program certificate. So I kind of bookmarked it, put it in the back of my mind. So during the time I was at BSU, I actually started to apply for that certificate, that postgraduate certificate. But when I went to do that, they were shut down. They were no longer accepting applications. Later, when I was at Gallaudet, I was looking for a play therapy class and I actually found one in the counseling department. After that class, I was completely hooked in play therapy. I started looking for externships, experiences that can really help me get some play therapy experience, direct contact supervision hours. And that's when I found the Lori Center, or the LC. The Lori Center for me was just an amazing place. I really cherished my time that I was there and my experiences there. I was at the Lori Center for 2 years. The first year I was an extern, and that second year I was actually a paid employee. Becoming a registered play therapist, I think the requirements have changed a little bit now, but for me, if I remember correctly, supervision, the CEUs, I had to do 150 CEUs, or continuing education units, directly in play therapy specifically. I also had to do 500 play therapy hours that were supervised. So what is play therapy? In short, play therapy is an approach that allows children to use their natural language. So a child's natural language is what? It's play. Adults can use their voice or sign to communicate their ideas. But children can't really process information the same way with words or with signs, not in the same way that adults can with language. So play allows children to open their world to us so we can see their world. Play therapy actually has two different avenues. The first avenue really has three parts for the theoretical orientation: psychodynamic theory, attachment, and Rogerian. It's kind of really all those three. Yes, play therapy has more theories than that, but those are maybe the primary three that people really think about. The second avenue for play therapy is kind of called directive. That approach is more behavioral in nature. It's not Rogerian at all. The first one, we call that non-directive play therapy, and that second one, again, is directive play therapy. Those two. Well, I really identify with the first one, non-directive. That's my experience looking at the Rogerian approach, psychodynamic, and attachment. Play therapy has a lot of evidence and research really for the full age range, somewhere between ages 3 all the way to people in their 80s and 90s. Has a lot of evidence for all of those ages. But if I'm correct, I think the Association for Play Therapy, or APT, requires most, if not all, of your direct service hours be with children ages 3 to 17 years old. You can, of course, ask for special permissions for those other ages if you ask the board. Now, for younger children, like babies and toddlers who have experienced trauma, which really is my area, that's my niche, for that I actually practice something called CPP, which is child parent psychotherapy. And that's for children from birth to age 5. I work with young children, babies, and families, parents, and people in their perinatal experience, that kind of work. If you want to learn more about me or my practice, please visit my website. You can also find me on email. And you can find out those information down in the description. Thank you. Playfully Psyched.